So I'm Ben Shepherd and I'm an emergency medical technician for East Midlands Ambulance Service.
I'm Darren Stones and I'm the watch commander for Lincoln South Fire Station.
I think being an ambulance crew on Bonfire Night, it's quite varied. We're still obviously dealing with all the normal emergencies. Have been called out to an event that we know is a firework event, firework related. It's all a little more heightened, and we are seeing quite some increase in the number of incidents year on year. I think professionally we stick to protocol. We have a number of things that we're going to do. We want to make sure that the child's got an airway that's fine, that we're controlling the pain, and that we're trying to stop any damage from getting worse. Personally, having children myself, that sort of an incident, it does hit you harder afterwards. And in this particular case, the child did lose vision in one eye and will have scars to the face. That will be an everlasting reminder. I think you do start to think about that a little bit more after the event.
Just make sure you follow the firework code. And some of the safety tips I'm going to have to give you is don't let children play with fireworks. Always supervise your children and pets as well, so that they're not getting involved with the display. And if you're having a bonfire, never leave it unattended.
There are a number of things that we want to do and we want to make sure of. So first off, let's remove any burning clothing. Unless it's sticking to the skin, I want that gone as soon as we can and the area exposed. Then we're going to want to cool the burn for a maximum of 20 minutes, and we want to use cool water. We don't want to use ice water or ice, because that will have an effect later on in the healing process. If we can get rid of any jewellery that they might be wearing or any tight bands, because there's going to be some swelling. And also if we can start to think about looking towards the face and the head. If there's any burning to the face, if there's any singeing to the hair, if there's any black soot around the mouth or the nose, if the child's coughing up anything black, or if there's a wheeze, well then we're going to want to deal with it. That is a 999 emergency, or get straight to A&E where they can deal with it. We don't want to use any ointments or creams. That's going to make it harder for us to assess as medics or for the doctors to assess later on. And as for dressing burns, after you've cooled it, then cling film is usually the best. Don't wrap it tightly, it just wants to be on loose to allow any swelling to take place. If you haven't got any cling film, then any bandaging that's not going to stick and is wet, it must be wet before you put it on. And as for when to get us involved, as I say, if we're worried about the airway, about the face, then that's a good start. Alternatively, you can take the child's hand, and if you imagine their hand and their fingers, their palm and the fingers, that is roughly about 1% of the body surface area. 10 hand places of burn, 10%, then that child needs to be in hospital. Otherwise, if you're concerned about the burn, then take the child to hospital yourself, or if that's not possible, 999, and we'll be happy to come and take a look. I'd say that in the last 5 years, we've seen the number of burns, injuries from fireworks in particular in this country double to 4,500 in 5 years. Now, when you consider that Lincolnshire treat 150,000 people in hospital totally, in A&E totally in a year, then that might not sound a lot. But when we consider other countries that are 50 times the size of ours, like America, they only have 11,000. They only have just over double the amount of injuries. We are seeing so many burns that are preventable, or injuries that are preventable.
The advice I'd give is, if you light a firework, never go near it again, because occasionally they look like they've gone out, but they still have the potential to explode if you go near them again. And also, never give sparklers to children under 5.
My advice would be, go to an organised event. It's an organised event, you have pyrotechnic experts, you have first aid on hand, on site, you have emergency service plans are already in place. They have to be in place before the event can take place. and you're also going to get a bigger bang. They're going to be allowed to use bigger fireworks. It's going to be a better show and a better atmosphere. So my advice would be go to those. If that's not going to be the case, then no alcohol, no holding babies and sparklers. In fact, sparklers, perhaps there are other opportunities for glow sticks and things like that to be used. I think that's really my advice. They are very dangerous. Treat them with respect or go to an organised event.
As we all know, that fireworks and bonfire nights can be great fun, but also can be very, very dangerous. And I echo the fact that actually if you can attend a organised display, they are a lot safer and far more enjoyable.